Hi everyone, this is Aurelie Najm from Glasgow. I hope you had a great time for day one of ACR. I actually surely did, and I'm really glad to be here with you again for day two. A couple of abstracts today I want to discuss with you. And you know, this is a very common situation that I've got, at least in my practice, with either ACPA or psoriatic arthritis patients that failed to respond to a first TNF inhibitor, and then the question always is, do we switch or do we cycle? And we do have data suggesting that maybe switching for a different mechanism of action in RA would be more efficient. We don't really have that data for PsA or axial spondyloarthritis. So first abstract is 1499, presented as a poster by Philip Mies. So basically what they did is they looked into the CoreVitas registry, and this is ACPA and PsA patients, but they looked specifically into the ACPA patients, and it was only a small number, it was about 80 patients. But they looked into those who's been cycled to a second TNF inhibitor after an inadequate response to a first one. And what they saw is that the percentage of good response after the 6 months of the second TNF inhibitor is actually really low. In fact, at 6 months, only 15% were reaching ASDAS low disease activity, 7% were showing a minimally clinical improvement, and basically 0 patients were having a major improvement. So this is not very encouraging, and this is not very suggestive of showing we should probably not cycle for these people. Now moving to the second abstract, 1600, presented by Alex Ojdi et al. Basically it's the same registry, CoreVitas, but at this time they looked into PsA patients, and basically it was about 400, and they looked into those who switched versus those who cycled towards the second anti-TNF, and it was in PsA patients this time, not in ACPA. And there are a few things that they found out. So first of all, there was about 50% switching and 50% cycling. Those who switched for a different mechanism of action in general had a higher disease activity, higher severity of psoriasis. And on top of that, they also were less likely to have a minimal disease activity state. Now, what are the results? Actually, at 6 months, they show that those who were switching, in comparison to those who were cycling, were more likely to achieve minimal disease activity, about 7 times more likely actually. They were also 3 times more likely to reduce their PAN scores, and 2 times more likely to reach an HAS-DQ inferior to 0.5. Now we need to keep in mind that these were not necessarily significant. They were mostly trends here, and it's probably with confidence interval usually crossing 1. Probably because of a small sample size, but these data are quite suggestive that we should probably switch more than we cycle. So that was this for today. I hope you are enjoying the conference. Tune in on rumnow.com for daily ACR coverage, and I'll see you soon.